Hi guys, my name is DR Krishna. I am a third year student of Antigen State Medical University. Today we are talking about the topic diabetes mellitus type 1. As you all know, it is formerly known as juvenile diabetes and it is an autoimmune disease. First of all, what is type 1 diabetes? Type 1 diabetes is a chronic, that means a lifelong autoimmune disease that prevents your pancreas from making insulin in your body. What is the difference between type 1 and type 2 diabetes mellitus? While type 1 and type 2 diabetes are both forms of diabetes mellitus that lead to hyperglycemia and they are distinct from each other. In type 2 diabetes mellitus, your pancreas doesn't make enough insulin and in your body doesn't always use that insulin as it should usually due to insulin resistance. And in type 1 diabetes, your pancreas doesn't make any insulin, it's caused by an autoimmune reaction. Type 2 diabetes usually affects older adults, though it's becoming more common in children. And type 2 diabetes usually develops in children or younger adults, but people of any age can get it. And who does the type 1 diabetes affects? Anyone at the age of developed type 1 diabetes mellitus. Though the most common age of the diagnosis is between like 4 to 6 and in an early puberty like 10 to 14 years of age we can affect this diabetes mellitus. And in the United States, people who are non-Hispanic white are mostly likely to get type 1 diabetes and affects mostly females and males equally. How common is type 1 diabetes? Type 1 diabetes is relatively common in the United States. Approximately 1.2 million people live with type 1 diabetes and the number is expected to grow to 5 million to when it comes to 2050. And main symptoms and causes of this type 1 diabetes mellitus are like excessive thirst, then frequent urination, including the frequent full diapers in infants and bedwetting in children, excessive hunger and unexplained weight loss, fatigue, blood vision, slow healing of cuts and sores, and vaginal yeast infection will be caused by this. And mainly, if a diagnosis is delayed for this type 1 diabetes mellitus, it will be called like diabetes-related ketoacidosis. Seek emergency medical care will be given to this child experiencing these combinations. Mainly the symptoms for these diabetes-related ketoacidosis is like fruity smell breath, nausea, vomiting, abdominal pain, rapid breathing, confusion and drowsiness. And what causes these type 1 diabetes? It is an immune system disorder which mistakenly attacks and destroys the cell in your pancreas that make insulin. This destruction can happen over months or years, ultimately resulting in a total lack of insulin. Although scientists don't know yet the exact cause of the type 1 diabetes, they believe there is a strong genetic component. The risk of developing the disease is no family history is approximately 0.4%. And diagnosis and test for this type 1 diabetes. Type 1 diabetes is relatively simple to diagnose. If you or your child has symptoms of type 1 diabetes, your healthcare provider will be ordered to following tests like glucose test, blood glucose test, then glycosylated hemoglobin test like A1C. That is like if a glucose level test will be results in indicate you are having diabetes, your healthcare provider may do have an A1C test. This measures your average blood sugar level over 3 months of your age. And then we will be having an antibody test for checking the antibodies to determine how you will be affected with type 1 and type 2 diabetes. How should we treat the type 1 diabetes mellitus and how should we manage this type 1 mellitus? People with type 1 diabetes mellitus will be synthetic insulin available multiple times a day in order to live to be healthy. And they also need to try keep their blood sugar within a healthy range. Since several factors affect your blood sugar level, type 1 diabetes management is complex and highly individualized. Three of the main types of the type 1 mellitus include insulin, blood glucose monitoring and carbohydrate counting. Insulin for the type 1 diabetes management, there are different types of synthetic insulin. They each start to work at different speeds. And the amount of insulin you need to throughout the day depends on the several factors including your weight, your age, your physical activity, your types of food you eat, your blood sugar level at any given time. And you can take insulin in following ways: multiple injections daily, and you can use an insulin pen similar to use these injections. And you can use insulin pumps for the diabetes mellitus. And you can also monitor insulin by type 1 to monitor glucose throughout the day, maintaining the blood glucose range in the best way. by blood glucose meter and continuous glucose monitoring. And what are the side effects of the diabetes treatment? It will be main side effect of the diabetes treatment through the insulin is low blood sugar. Low blood sugar can occur if you take too much insulin based on your food intake or activity level. Hyperglycemia is usually considered to be low 70 mg per dl, milligrams per deciliter. Symptoms of the low blood sugar can start quickly with people experiencing them in different ways. Is there any cure for type 1 diabetes mellitus? There is currently no cure for type 1 diabetes, but scientists are working on ways to prevent or slow down the progression of condition through studies such as trial. And what are the complications of type 1 diabetes? Potential complications of type 1 diabetes includes like eye problems such as diabetes mellitus retinopathy. Then food problems including ulcers and infections can lead to gangrene. Then heart disease and high blood pressures. So guys, I think the video was informative for you. Thank you.